trainer. Saul Luna is responsible for the prevention and care of injuries for the Aggies men and women's track and field and cross-country teams. A native of San Diego, Texas, Luna graduated from San Diego High School in 1994. After graduation from San Diego, Luna attended Texas A&M University and served as a student athletic trainer under Karl Kapczynski. Upon graduation in the fall of 1999, Luna served as head athletic trainer at Brownsville Pace High School from January 2000 through March 2001 before moving on to Corpus Christi High School, or Carroll High School, where he served as head athletic trainer from March 2001 to May 2006. In August 2006, Luna returned to Texas A&M to begin work on a master's degree. In spring 2010, he completed his Master's of Education in Agricultural Leadership, Education, and Communication, and joined the athletic training staff as a full-time athletic trainer that fall. Welcome to Spats, Saul Luna.
Howdy. So I'm an Aggie from Texas A&M University, and that's how we greet everybody. We say howdy. When we say howdy, everybody says howdy back. You're not required. I'm just kind of filling you in a little bit on how we do things at A&M. I was so excited when I saw that I was speaking right after lunch because I was counting on people not being here. You guys are here, and so I am just beyond excited to be able to talk with you. I hope I don't, after lunch you want to kind of take a nap or whatever. I hope that I don't help you with that, and I hope that I'm able to, keep you interested in what it is that I'm talking about. As was mentioned, I am the athletic trainer for track and field and cross country at Texas A&M University.
Two strides going into the last leg. Malik Curley making the late pass on the outside for Texas A&M, and the Aggies would finish with a meet record of 3 minutes and 2 seconds. They would put on a show for the home crowd as they crossed the finish line. Texas A&M edging out Florida by a half point to take home the men's indoor championship.
So it is a huge blessing to be able to be associated with the track and field team at Texas A&M University. Been there 11 years now. We've won 9 national championships, and I can honestly tell you that without dry needling, none of those championships would have happened. And so to be able to be here with you today and talk to you a little bit about the influence that dry needling has had on my program and what it is that we do at Texas A&M University with regard to track and field is truly an honor. I would like to start by acknowledging a few people, Mr. Phil Hedrick, our head athletic trainer at Texas A&M, and Dr. J.P. Bramhall, our director of sports medicine. And I just want to acknowledge them and thank them because of their vision, and trusting us as athletic trainers at Texas A&M University to use this powerful modality. I want to thank Dr. Vincent Henderson for allowing me to be his apprentice for the last 11 years and having the opportunity to watch him needle and now have him watch me needle. And then Dr. Mark Scapitici for his mentoring and for working with me and helping me to understand more about what it is that I'm doing with that needle. With regard to conflict of interest, I have served as an unpaid co-instructor for the Fit Institute's dry needling courses. Okay, so when I was an athletic trainer at the high school level, so I was at Brownsville Pace High School back in 2000, I would have athletes who, I was constantly battling the situation where my athletes would go across the river to Mexico and get stuff done and then come back and they'd end up with some type of hot balm on their leg, wrapped up or whatever, and they'd tell me about these mystical treatments that they were getting, and I was like, what is going on? What's happening, right? And then I went to Carroll High School in Corpus Christi, and I had athletes that were going to go see this doctor, and they would come back and they would tell me something about their ankle was out of place, and I'm like, what are you talking about? And I just didn't know. It was so frustrating because there were obviously these doctors weren't communicating with me. They weren't telling me what's going on, and I didn't know what they were doing, right? So from that point on, it made it my mission to learn what it is that was going on out there. What treatments were my athletes getting? What were these gurus doing that I didn't know? Okay? And so with regard to dry needling, that is something that is growing in popularity around the nation it seems like every year. When in preparation for the seminar, I looked at the research. The research has really spiked here in recent years, And so if those of you that don't know what dry needling is, my intention for today is to help you understand what it is, how it's done, what the benefits are for your athletes, when shouldn't you do dry needling, can you do it yourself, and if you can't do it yourself, who can you find that can do it for you? Because that way, we as athletic trainers can help to direct traffic a little bit, right? We can help quarterback and make sure that our athletes are getting whatever they need, okay? So, what is not dry needling? That is not dry needling, okay? I couldn't sleep when I was a kid and I saw this, right? And I was like, man, what is going on? What's going on with this guy? But we see this, right? Here's another picture of what dry needling is not, right? And these are the stereotypes. These are the things that we see, and we're like, man, just sticking a bunch of needles all over the body. You know what, guys? That is not dry needling, okay? Now, another thing dry needling is not is acupuncture, okay? So, what is acupuncture? Well, depending on what source you look at, they will all vary in how old acupuncture is, right? So this particular source that I looked at, we're talking about it's over 8,000 years old, okay? So 8,000 years ago, back in the East, right? So we'll call the East China, there were people who were concerned with health and wellness, right? Kind of like us, right? We're all concerned with health and wellness. And so in evaluating the body, what they found was that there were flows of energy, right? And so when energy was flowing properly, then you had health, you had wellness, you had longevity, you had all that. Occasionally, there will be blockages in this flow of energy, okay? And so those blockages could be found at certain points, okay? And those later are what evolved into acupoints. And so what they discovered is that by sticking sharp instruments into these points, they could get a result, right? So we started out with sharp pieces of wood, which I don't know how that happened, right? Other than a toothpick, right? Picking, I don't know. Sharp pieces of bone, And so that's kind of how the practice of acupuncture started, okay? So once again, you're thinking about flow of energy through the body. You're thinking about blockages to this flow. And you're thinking about what you need to do in order to get that going. The whole purpose here is balance. Okay, we want balance and we want health. Okay, so what is dry needling? So we have here is one of my athletes, Texas Relays, April 1st. She's coming out of her push, and sniper got her, and she's going down. Okay, so when I was an athletic trainer in the high school world, this was my experience with a strained muscle. Athlete strains a muscle. Cool. They come in, we do whatever modalities, whatever treatments we're going to do with them. Maybe we'll get them back in about a month, right? They're probably going to strain it again. And then after that next strain, they're either done for the year, or maybe we'll get them to compete a little bit more, and then, whatever. Bottom line is their performance dips, and they did not have a great experience, right? Of course, that was many, many years ago. Now, as we've gone forward, there's so many great and exciting modalities out there. I really liked the PRI talk that was here before us. I was very interested by that, and the balance of the pelvis, etc. That was great. Now, with regard to us at Texas A&M University, so this was April 1st, and excuse me if the video is not quite clear for you. Oh, man. Sorry. I'm sorry if the video isn't quite big, but if you're able to see this video, that is my athlete doing a rep in practice on the track 11 days later. Okay, so what I can tell you guys is that she not only started practicing 11 days later, she was able to come back to competition and compete well enough to qualify for the national track meet, which was just this past weekend, and she was able to race there, right? No re-injury, no problem, okay? And so the main modality that we used in helping her get over this problem was dry needling, okay? And it is because of what I've seen. I was joking with somebody before I started talking that I've seen people rise from the dead with dry needling. Like, we're talking someone strains a muscle the day before they race, we're able to address it with other ways, right? But using dry needling, and that person is able to come back and perform and be successful. So, and once again, because of this, I just had to share it with the athletic training community. Okay, so what is dry needling? Well, dry needling is based on Western medical principles and involves the use of a solid filiform needle. Okay, so I know Butch has some out there on his table. You know, it's a needle, and we're able to find certain spots in the body where, you know, typically we find what's called the trigger point. You know, in the 40s, Truel and Simon, they identified these tight bands. In these tight bands is a central little painful hard nodule, okay? And so that's what they started to call trigger points, right? And so as they were trying to resolve these trigger points, they were trying different methods. So if you've actually studied them, you can use pressure, you know, elbow, thumb, you know, you can use a pressure bar, you can use spray and stretch, right, where you use the, you know, ethyl chloride and you spray the muscle and then you stretch it, okay? You can use cold compresses, you can use heat, you know, you can use any of these modalities to try to get that little band to open up, right? Well, they also started experimenting with injecting lidocaine and substances like that into the tissue to try to get it to let go, okay? And so in the 70s, Dr. Carl Lewitt began to wonder, like, hey man, like, is it the stuff that we're injecting into the tissue that's giving us the result, or is it the puncture that's giving us the result, right? So he did some research, and he found that his results with just creating the puncture were just as good, right? And so Carl Lewitt was one of the first people who actually began to practice dry needling in, you know, to treat muscular pain and muscular dysfunction. Okay, so now I want to go over a little bit of what the research tells us about dry needling, right? Because, you know, all I know is that it works, right? All I know is that I see people, you know, have problems and be able to overcome them, improve their outcomes, etc. But what specifically is going on when that needle is going into the tissue? You know, the reason why I titled my talk, it's about more than the needle, right? Because all we're thinking, you know, when we hear dry needling or acupuncture, all we're thinking about is that needle going into the tissue, right? But what I want us to think about is all the thought process that went into deciding, why am I sticking a needle in there, and why did I choose this point, okay? So, one of the things that we think that dry needling does is improve circulation, okay? So, this study with the Skrakuska looked at sciatica under infrared thermal vision and vasodilation. So basically, they took this infrared thermal vision and they took measurements of the temperature of the area, you know, pre, and they checked it post. And so when they stuck the needle in there, they found their trigger points, and they found that, you know, first of all, they were able to find, based on these temperature readings, that 1 in 3 people actually had these trigger points active. Okay, so every person that actually had a positive trigger point, once they stuck the needle in, so they checked the temperature, then they stuck the needle in, then they checked the temperature right after they stuck the needle in, then they checked it again a few minutes later, right? And they found that the people that actually had trigger points in that muscle actually had an improvement of circulation, right? So what we know is that dry needling may help improve circulation. Okay, so with regards to increasing strength. So this study is with Hazer, and is dry needling on thigh muscle strength and hip flexion in elite soccer players. So once again, what they did here is they took soccer players, right, elite guys that are pro guys, and they tested them, right? They tested them on the Cybex. And so what they were doing were these forceful contractions, you know, leg extensions, and then afterwards they would check their hip flexion as well, right? And so there was a group that only did exercise, and then they had this like water pressure massage device that they used on them, and then they had people that actually did the dry needling, right? So what they found was that the people who actually got the dry needling, that they actually had improved strength and they had improved flexibility, right? So with regard to us and what it is that we're trying to do, you know, we know that it's possible that we could improve our outcomes with rehab and dry needling. Okay, so what does the research say about improved mobility? Okay, so this one is from Pasigli, and it talks about the acute effects of dry needling on posterior shoulder tightness. So this was a case report, right? So what they had is they had this guy that came in, and he just had this shoulder pain, and so they did a full assessment, and they evaluated him, and they had all their measurements, and they had everything, and they said, hey, you know what, this guy does have some issues. So then they went ahead and they tried some dry needling. You know, they did the infraspinatus, they did the teres minor, and they did the posterior deltoid, okay? So then immediately after the dry needling, they found that this individual had improved mobility, but more importantly, the mobility was still there after, okay? And I think that's really the biggest thing that I want to push to you or talk to you about is this is a long-lasting effect, guys. Like, I'm a massage therapist as well, okay? Joe Ramos inspired me. I don't know where Joe is, but I always looked up to that guy. And Joe was a massage therapist, and I wanted to be like him, okay? And so when I became a body worker, I found that I could get a return on my investment soft tissue-wise, but it was not permanent. It wouldn't stay, right? And I had to keep working and working and working on these people on a daily basis. And like I said before, they just get hurt again, right? And so it was very, very frustrating. Of course, now that I've grown in the profession, I know things about joint malalignment and other contributing factors, right? But the bottom line is that I couldn't get my job to work, okay? I couldn't get it to stay. And now what I can tell you is that by using the needle, I can get a significant change in the soft tissue that is actually long-lasting, right? At the end of the day, that's what we're about, right? We're about helping people to become successful and to stay healthy and to have a good quality of life, right? Like, we want our athletes to be happy and to do what it is that they want to do. If we're working with patients, we want to help them, right? We want this to be lasting. And so what I can tell you is that the benefit of the needle is without question, you know? So we've already seen that what we can do is we can help with circulation, okay? We can help with mobility. We can help with strength, all right? So now we are going to look at how it helps more specifically with rehabilitation, okay? So this study was from Salah Moreno and company. And so they looked at trigger point dry needling and proprioceptive exercise for the management of chronic ankle instability, okay? So when you sprain your ankle, right, that tissue is stretched, it's overstressed, right? And so as an athletic trainer, I mean, we all have those athletes, right, that their ankle is just jacked. And we're constantly trying to work with them. We're constantly trying to take care of them, right? And we're all doing the TheraBand and the stability exercises or whatever. So what these people did is they said, well, you know what? Let's see if the needle will help to enhance our outcomes, okay? So they had two groups. One group that only did rehab. I'm sorry, I keep bumping. I don't want to annoy you guys. Okay, so we had one group that only did rehab. And then we had another group that did needling and rehab, okay? They had to complete a questionnaire pre and post, okay? And that's kind of how they assessed it, right? Well, what they found is that the people who received the needling in their tissue and then did rehab had a better outcome, okay? Now, we just saw in the previous studies, hey, well, you know what? It's been shown to improve strength. It's been shown to improve circulation, right? Okay, well, now we know. We have an idea as to why maybe this worked out for them, right? We also saw that it helps to relieve tightness, okay? And so what they found overall was that, once again, you know, and I want to highlight this, the people who did this program resulted in a better outcome in pain and function 1 month after the therapy was completed. So once again, what we have here is an effect that is long-lasting, okay? It's not temporary. It doesn't. You know, and that's what we're seeing. And that's what's exciting about this modality. Because seriously, you stick the needle in, maybe a few seconds, you take it out. So, like, that's how quick that this can be, right? And so it's really exciting. All right, so now we've looked at what the actual research is saying about dry needling. Okay, now let's see what the athletes are saying. Okay, so I interviewed some of the athletes at A&M, and so we're going to listen to what they have to say about needling. So can you tell me what you think about needling?
I really like needling. I feel like every time I'm needled, It takes about 20-25 minutes. It's really painless. It kind of shakes out my muscles, shakes out my nerves. It makes me feel a lot better. It feels like my legs kind of opened up and my blood's flowing a lot better, so I really like it.
Okay, so you think it improves your performance?
Yes, I definitely do. A lot of times when I've been needled, my legs have felt really tired, or maybe they were really sore, and a lot of times after I'm needled, they feel a lot better. They feel a lot more open. The blood is moving a lot quicker, so my legs feel a lot more jittery and bouncy, and it feels really good.
Okay, so not that this matters, all right? So I'm just saying this, right? If you've ever wondered, so in track and field we have an indoor season. So when it's cold outside, we run indoors in a facility kind of like this that has an indoor track. Then after spring break, it warms up, we go outside, okay? So if you've ever wondered what the fastest woman ever to run 800 meters inside looks like, that's her, okay? Now, why am I saying this? Well, I'm saying this because she achieved a level of excellence in her career, right? But without being healthy, she would not have attained that success. And I can tell you that on the day that she set the record, she had some issues with her legs. And dry needling was one of the things that we used to help her overcome her problem. Okay, let's look at another athlete.
Hi, can you give me your thoughts on needling?
My thoughts on needling, I've been getting needles since my freshman year in high school. And needling has just been the lifesaver of my life. Sometimes when you have an issue with the muscle or anything that's going on with your body, needling really gets to the source of the issue and makes my leg feel way looser than when I originally came in.
So you think needling helps with your performance?
Yes, most definitely. Needling helps my performance way more because it gets to the source quickly, and it's way better than stem or any other massage therapy.
All right, and now our last athlete.
Can you please tell me what you think about dry needling?
Dry needling is basically really help your muscle loosen up and stuff. Or you can you probably be sore the next day, but after that, it just loosens your body up and you feel back to normal again.
You think dry needling helps your performance?
Yes, it helps with performance.
So, once again, not that it matters, but if you want to know who the fastest male 400-meter runner is in collegiate history, that's that guy right there. And once again, I say this because without being able to take care of this man and keep him healthy, he would not have done that, right? Now, I didn't say anything about the middle girl, right? So why didn't I say anything about her? Well, so that young lady, even though she's had lots of needling, right, and she's familiar with needling, she didn't trust me, okay? So because she didn't trust me, I honored our relationship, right? Because as athletic trainers, our job is to get the athletes where we need them to be, right? So we have to nurture and we have to nourish our relationships with athletes so that they will trust us and do what it is that we're asking them to do, right? So this young lady didn't trust me, okay? So we did not get to use dry needling in her care until she got injured, right? When she got injured, as we're going through the process, as we're working through it, okay? Now she trusts me. Now I'm able to use dry needling. Okay, so she had a grade 2 tear in her rec fem, all right? So we diagnosed the tear. We used a PRP injection to initiate the healing, and she actually started practicing 2 weeks later. And then she also was able to go to the national meet, and she was able to compete with no problems, right? So, and I'm going to talk about this a little bit more when I talk about the precautions, right? It's really important that we have trust with the athletes and the people we're taking care of, okay? So, with regard to dry needling, so if we're going to do dry needling or if we're going to be involved with it, do we have to prep the skin the way that we prep for an injection, okay? So according to the research, not necessarily, right? We would use universal precautions like we always do, right? Trying to minimize, we have to wash our hands, we want to use gloves. We should try to avoid, we should never touch the shaft of the needle. Whatever's going into the skin should not be touched by our skin, right? So we need to make sure that we're gloved up. If we're going to clean the skin with alcohol, we have to remember, guys, that there is a difference between being sterile and being clean, right? If we want something, and this is something that I talk to my student trainers about. Every day we wipe down the tables, right? What do? We spray the tables down and then we wipe the stuff off, right? Are we disinfecting? No. right? Because if you read the bottle, it says, let's stand for 10 minutes or whatever in order to make sure that whatever it is you're cleaning is dead, right? So the same thing goes with the skin, right? If you're going to actually try to make sure that you are sterile, then you're going to have to disinfect it, right? Otherwise, all you're doing is cleaning, okay? And so once again, the research shows that, they looked at all these studies over the years and incidences of people getting infections, and the actual infection rate is very low. Like I'm talking, I have seen people get needled sweaty, dirty, and the needle goes in and goes out, and the person doesn't have any problem. I'm thinking staph, I'm thinking all these things, and no, nothing happens. There hasn't been an issue with it at all, right? And so if you want to read a little bit more, I recommend the book by Dommerholt, and I've cited it here on the actual presentation. Okay, so what are absolute contraindications for dry needling? Well, first and foremost, an unwilling patient, right? Like I told you guys, my athlete was not comfortable with me, right? She's like, who is this guy? Like, he can't put needles. Like, I'm seeing a chiropractor. Like my chiropractor is the man, right? And you can't do this to me, right? And that's kind of the way it was, right? And so then, of course, as we progress in our relationship, and as she gets to know me, and as she sees what I'm doing, then she trusts me, and then she let me needle, right? Even though I knew what she needed at that point in time, but I had to get her there, right? So if you have an unwilling patient, that is an absolute contraindication, okay? If you have a medical emergency, if someone's having, stroke signs, oh, I think it's, one of the muscles in the back, let me dry needle it. No, man, call 911, right? Like, take care of the problem, right? Most importantly, lymphedema, anyone with that type of symptom, we don't want to deal with that. Or if for any reason it's inappropriate, let's say that you are dealing with a young lady and the problem is up here. Hey, you know what? The benefit of the needling is not that important, okay? So if there's any question of inappropriateness, if our little sixth sense goes off, which that's one thing that I appreciate about our profession. Hey guys, we know when something's wrong, right? Like, it's weird and it's hard to explain, but we know when there's a problem. I had a guy in the training room this fall. He came in. Oh man, my back of it's just hurting so bad back here. It hurts when I breathe. Hey, I've seen this 1,000 times, rib dysfunction, right? But my sixth sense went off and something was weird. And the guy, he was just having trouble, right? So my team doc happened to be in that day. For kicks, I sent him to the team doc. Team doc sent him to the health center. This guy had a collapsed lung, right? And so that could have worked out totally bad, but it didn't. Why? Because I have the sixth sense, right? We all have the sixth sense. We know something inside us tells us something's wrong. So the same thing goes with this needling. If there's something in you that's telling you this is not worth it, then don't do it, right? Listen to your instincts, okay? So these are relative contraindications for bleeding. So any type of abnormal bleeding tendency, okay? From time to time, you will stick needles in. I would guess that I've stuck several hundred in, so maybe 75 will bleed after, right? So if somebody has a problem with clotting or they're not able to, stop breathing properly, then, that's something that we need to consider. Maybe we don't need the needle, okay? Somebody has a compromised immune system, you know what I mean? Now, the reason why, compromised immune system is up there is because if you really dive into the research, there's not a lot of, needling hasn't really been linked to, a lot of infections and things like that. But what happens is if you've needled somebody and then like a week later or whatever, they come down with some kind of infection, then the doctor is going to do what? Take a history and, oh, you've been needled. That's it, right? So, to be safe, if anyone has any type of immune problem, let's not needle, okay? Vascular disease, diabetes. The reason why diabetes is up there is because if that person has trouble with wound healing, right, we don't want to go create a wound, right? So that is also a relative contraindication. But if the doctor says it's fine, then fair game, right? Same thing with children. Children is up there mainly for consent purposes, right? I wasn't able to find anything in the research that would tell me, like, oh, at the age of 7, they can start needling, right? My mentor, he says he's been needling his kids since they were 5, right? So once again, that's why this is a relative contraindication. Frail patients or people that have metal allergies, etc., that's something that we should think about, right? It's kind of like, so this vendor was showing me this massage lotion, right? And he told me, this massage lotion doesn't have any peanut products in it. And I'm like, peanut products? products. And I was like, man, I never thought about that. If people have peanut allergies and you're rubbing them down with lotion that's been made with a peanut product, you could be having a problem, right? A rash or whatever. So I thought that was interesting, okay? So by the same token, if somebody has a weird allergy, metal allergy or whatever, we should consider that and we should think about that when we're thinking about should we needle this person or not. Okay? The number one contraindication to dry needling is anatomical considerations. Okay? Now, when I was a high school athletic trainer, right, on the football team, it was always the Thursday, the varsity plays on Friday, they have the Thursday practice, and the starters, there was always, the one athlete who's trying to prove that he belongs or whatever, and he's going really hard on the Thursday, and then the starters get all mad, right? They used to call that guy a practice hero because he was doing the most. He's like, chill out, man, relax. Like, you don't got to do all that, right? Well, the same thing applies here with the needle, right? A lot of the problems that are in the research that happen, the number one thing that goes on is somebody has a punctured lung. Why? Because somebody has that pain right here or right here, right? Oh, you know what? Let me just stick a needle in there, right? Well, guess what's underneath that? The lung, right? So people are trying to do too much, and what they do is they end up puncturing the lung, and then we have a big problem on our hands, right? So that's the number one thing that you got to consider, right? What blood vessels are in the area? If I'm trying to get into the forearm, is there a chance that I'm going to nick an artery or whatever, right? Now, between you and I, is there really a problem if you nick the artery? Well, let me ask you a question. Do you give blood? How many times have you been stuck? And do you have any weird outcomes from that? And have you seen how big that needle is and how it's designed to damage? And get a chance and stop by Butch's desk and look at a dry needle, right? So are you going to create a big problem if you nick an artery or something like that with a needle? No, right? But we should still be mindful and we should still be careful with it, right? We want to watch out with nerves, right? Your nerves have a wonderful sheath that protects them. So trying to stick a nerve with a needle is like trying to hit an individual piece of spaghetti with your fork, okay? That's the way our body's created. Our bodies are awesome, right? So what will happen, though, is if you get in the proximity of that nerve, then you're going to get that nerve sheath, and you're going to get a zing or a shock. And the person's going to say, ow, it hurts. Like, it shot into my leg or whatever, right? So then you as a practitioner are like, okay, did it go away? Yes, it did. All right. So did I strike the nerve? No, right? I nicked the sheath, right? Now, if you stick the nerve in there and it shoots in the leg and it keeps shooting, okay, now you've actually gotten closer to damaging the nerve, and that's when you should back your needle out and be careful, okay? So, once again, we want to try to avoid those if at all possible. We need to know where those things are, okay? Organs, definitely don't want to needle over the heart or the stomach, or be mindful of those things, right? Implant devices and joints. We got to be careful when we're needling, if we're considering needling those. Okay, so adverse reactions to needling. So what are some things that are going to happen, right, if you needle an athlete or if an athlete is needled? Well, first thing that will happen is there'll be pain, and I'll talk about that here in a minute, okay? There'll be bleeding sometimes. When you bring the needle out, there might be a little droplet of blood that emerges. All you got to do is blot that out, and the body will clot, and it'll stop, all right? Sometimes they'll get bruising, right? They'll have a big bruise on their body, okay? That's an adverse reaction. In some instances, people start to want to faint, right? So if I'm in a needle session and one of my athletes starts to feel weak or weird or whatever, then we just stop, take the needles out, stop the needle session right there. Give them something, give them some Gatorade to drink, care for them the way you would care for somebody who's in shock, right? Just get them to relax and get them to be cool, right? We want to be careful. There have been some instances of infection like I talked about, drowsiness and fatigue, okay? Now, some people talk about how the needle actually has an effect on our sympathetic, parasympathetic nervous system, right? So in some instances, the drowsiness and the fatigue is actually a good thing, right? Because the person is relaxing and they're calming down, right? And it's relieving abnormal stress that's going through their body or that they're feeling, right? So it's actually a good thing, right? But it's not a good thing if they're trying to practice right after you've done needling or whatever, right? So that's why you should be cautious with when. But you should know that that is a adverse reaction. And then, of course, the pneumothorax, all right? So with regards to pain, all right? So I have, I don't know, maybe 300 needles that have been stuck in my body. And I can tell you with full confidence that I have not felt 250 of them, right? The 50 that I felt were in the foot. Now, if you want to like torture somebody, needle their foot. Like if you have somebody that you want to be, that you're just great friends with, and you just want to show them how much you love them, put a needle in their plantar fascia, and they will know how much you love them, right? It hurts like heck, right? But what I've also noticed is that if an athlete comes in, they say, I don't like needles, it's almost 100% that they're going to feel the needle. It's going to hurt, okay? Now, if somebody comes in and they have an open mind about needles, they're not going to feel anything, right? But you should know that pain is sometimes going to be there, right? So if you have an athlete who's really excited and you know they're going to make a big deal about things, you got to be ready for that, right? Because there's going to be a show in the training room that day, right? And so you might elect that maybe needling is not what you want to do, okay? So those are kind of my thoughts and my observations on needling. Let's see what the athletes have to say.
So, do needles hurt?
Yes, they hurt, but it's worth it. The pain is worth it. I recommend that you do it.
Okay, so this is one of the people who I don't like needles, and I don't like needles, right? Okay. Now we have our needle veteran.
So, do needles hurt?
No, needles do not hurt. Personally, I have a high pain tolerance, but there are times where needling, it may seem as if it hurts, but it doesn't. It's more like a tight pressure, but over time, as the needle stays in, the longer period of time, it loosens up, and then there's not even an issue.
Okay, so we have one hurts and one not, right? And then we have our tiebreaker.
So, do needles hurt?
Yes, needles hurt.
So the thing I love about this guy is that before this interview, I didn't know they hurt him. Like, he's just there like this, right? And I'm just doing my thing, doing my work, and I'm thinking this guy isn't, like, he's like myself. He doesn't feel anything, but apparently he does, right? So there you have it, okay? So what are the indications for dry needling? Well, scar tissue, right? So sometimes we have scar tissue that's really hard and fibrotic, so we want to try to improve blood flow into the area. That's when we should dry needle. We saw in the research earlier that there is a temporary increase in blood flow into an area after needling, so we could definitely use that for increasing blood flow. We can use it to relieve musculoskeletal pain, and we could use it for trigger points. Trigger points, right? That word that exists, right? And we see people pushing their shoulder into the door frame and all that. You know, like, let's learn a little bit about those, and let's learn about how they come to be and why they are in our lives. Okay, so as we talked about before, you have to have a tight band. Okay, so it's not a trigger point or an active trigger point if you don't find a tight band with a nodule in the middle. And it's small, it's microscopic. You got to palpate over and over and over again. To be honest with you, the research shows, like, even, intervalar reliability. So, like, if I'm assessing for a trigger point and Joe Ramos is assessing for a trigger point, according to the research, we may not agree on what we found, right? And so that's kind of a little bit frustrating, right? But that's what the research says. Nonetheless, the accepted definition of it is you got to have a tight band, and it's got to have a tight nodule in the middle. Okay, so how does the trigger point form? A muscle gets strained. Okay, as a result of it getting strained, there is decreased blood flow into the area. Okay, because of this decreased blood flow, now you have an energy crisis in the tissue, right? Calcium is released. That calcium signals the release of acetylcholine into the area, so the muscle fires, right? The problem is that you don't have any blood flow into the area. You don't have any new ATP, so the body can't reabsorb it, right? It cannot reabsorb the calcium. So then that acetylcholine just stays there. The muscle stays locked. Actin, myosin, cross-links stay united, and that's where you get your little nodule that you can feel, right? And so that's what's going on. That's when you have a trigger point. So, like, if you go into the actual research again, the actual way that dry needling works or helps with trigger points is still kind of unclear, right? But we know that it may disrupt the contractured knot, it may stretch the contractured sarcomere, or destroy motor end plates. Now, you got to think about how tiny these things are, right? If you would actually look at these things on a microscope, they're tiny. And then look at the needle, right? So when you stick a needle in, you're doing damage, right? So according to this, you might be disrupting that, right? Once you disrupt that, then you bring blood into the area, right? And the blood nourishes the tissue, washes out the waste, and helps to start this whole calcium and acetylcholine cycle all over again. Okay. Now, when you're doing the dry needling, you might notice if you hit a trigger point exactly on, you'll get like a twitch, right? So that's called the local twitch response. All right. So, do I need to have a local twitch response every time? If I don't have a local twitch response, am I having an effect with my needle? Okay. Well, we just saw in the research, right, that if we stick a needle in, we could help improve circulation, right? We can help with strength. We can help with mobility, right? We can help our rehab, and we have a longer lasting effect. So something is happening in there, right? So the research confirms that a local twitch response is not always necessary in order to have an effect. Now, what I can tell you is that that's true. Right? In my experience, right? In my 11 years of dry needling, it is true. But what I can tell you is if you get a twitch response, man, that's the money shot. Like, there is no chance of that muscle getting tight again because you nailed the trigger point and you obliterated it and it's all good, right? So that's what I can tell you clinically, right? However, the research says, and like we saw in the research, like we saw previously, like you're having an effect when the needle is going in. You don't need to have a twitch response, right? Okay, so what do we really think happens when we put that needle in there? Well, obviously a wound is created. When that wound is created, you're bringing in the circulation. CGRP is brought in, okay? CGRP is a powerful vasodilator that helps to nourish the tissue and improve the blood flow. There's also nitrous oxide that is released as well. And this is something interesting because, in my readings, I found out that CGRP also helps to create new blood vessels, right? Which I thought was interesting. Okay, so like I had a girl that strained her hamstring in February, and she was not compliant with her protocol. So we developed a really nice piece of scar tissue. And like I was really frustrated with the scar tissue because I knew it was going to take forever to get out, right? And so we're looking at it on ultrasound, and man, that thing is thick, right? And when we looked at it, we saw that there was a tear. Right, because the scar tissue, she tore it, right, in trying to get rehab. So we had a little bit of a frustrating thing going on, right. So then the second time, once we got it going, started using a bunch of needling in there. Well, a couple weeks in, I noticed that there was in the area of the tear was this black spot, right. So if you look at an ultrasound and you look at muscle tissue, you see that the tissue is nice and striated, right. It's nice, it's very consistent, right. When there's a tear, you see like a shadow, a dark shadow, right? Well, this shadow was there, and it just wasn't getting better, right? And I was really upset because I'm like, man, we're doing everything right. It's not getting better. Well, and it just showed up, right? It was weird. Well, one of our team doctors, his name is Dr. Gill. Dr. Gill and I looked at the ultrasound together, right? And Dr. Gill was also kind of like, man, like she should be healed by now, right? Well, when you do your ultrasound settings, there's a little setting where you can actually look at vascularization. When he hit that setting, that little hole was opening and closing, right? So we believe that young lady, her body laid down a new blood vessel in that area, right? In as little as a month. So that was pretty cool, right? Now, did that really happen? I don't know. But that was exciting to see with the ultrasound that, the hole or the tear had actually healed, and what we were actually looking at was a new blood vessel that had formed. I was going to put the pictures on the slide, but I had trouble getting into the doctor's office, so my apologies. Okay, so, all right. So you've listened to what I have to say, and you're like, hey, you know what? This dry needling thing sounds pretty cool. What do I got to do? How can I utilize this in my athletic training room? Okay, well, the first thing we need to know is what are the laws regarding dry needling in your state, right? I understand there are some people here for out of state. Okay, here in the state of Texas, the laws are written in such a way where we can do anything that our doctors delegate to us to do, right? So if we have a team doctor who's working with us and who's supportive of us, and he allows you to dry needle, then you can utilize this modality under his direction, right? Now, if you can't, or if, that doesn't mean that like just because we can, if you don't have to do it, right? But in our state, PTs are also able to dry needle, and so are chiropractors, right? So it's important for us to know what it is that's going on with our athletes and what it is that's going to happen when they get this treatment, okay? Because if we know what's going on, then we can help kind of direct traffic, right? One of my athletes went off and saw an acupuncturist in town without my knowledge, right? So then he comes back. Okay, so I've been working with Dr. Henderson, 5 years, right? And I've seen the power of the needle, right? Well, then this guy comes back and he does not have the same benefit, right? And I'm like, that's weird. What's going on? Well, after I started questioning him, I found out that he did not see a chiropractor, he saw an acupuncturist, right? So what do we talk about? What's an acupuncturist going to do? They're going to open up channels and improve the flow of energy, right? So he was getting all these spots needled, which were, not helping the area, right? And so that was kind of interesting, right? So as an athletic trainer, I could then funnel my people away from that person and funnel them towards somebody who is doing what it is that I want done, right? So, the next thing we need is obviously a great relationship with our doctors, right? We have to get our doctors to trust us, right? And if our doctors trust us, then because ultimately is their license that's on the line, right? Because they're delegating to us their authority, So it's important for us to have great relationships, and obviously you need the right supplies, right? Okay, documentation with regard to needling, all right? So you obviously need to document whatever muscles you needled. You need to document how many needles you put in. You have to document the needle size. You can draw diagrams, on your low sheet showing where it is that you needled. You document any adverse reactions that they may have. I always take pictures. So every person that I needle, I take a picture, and I upload it into our software, and we're able to keep track of who it is that's getting needled and what's going on. Okay? So I think I want to add right into my modality menu. What do I need to know? My dream has always been to see a Karate Kid clip at one of our conferences, and today's the day. We're going to watch a clip from the Karate Kid because we have an important lesson to learn here from Miyagi.
When do I learn how to punch? Better learn balance. Balance is key. Balance good. Karate good. Everything good. Balance bad. Better back up. Understand? Yeah, I understand. When am I going to learn how to punch? Learn how to punch. Learn how to keep trying. No! You are going to be hiding here!
So I really, really like this clip, right? Because this whole movie, Daniel's always focused on what's going on, right? And he's totally not paying attention to all the great lessons that are around him and how Miyagi's really trying to teach him, right? And so here in this clip, like all he wants to do is learn how to punch, right? And Miyagi's like, man, I'll teach you how to punch when you learn how to keep your balance, right? Because his fundamentals were not strong enough, right? Now, with regard to dry needling, okay, all over this nation, there are battles happening in courtrooms, right? Because acupuncturists are saying that non-acupuncturists are not allowed to needle, right? And so some states, chiros, PTs cannot needle. We definitely cannot needle, right? Other states, they are, right? So us as ATCs having the opportunity to, with the cooperation of our team doctors, use this modality, the onus is on us, guys, to really take this thing serious and really challenge ourselves. One of the greatest things about needling to me was that it challenged me to get better, okay? And what's the biggest way we can get better at? With our knowledge of anatomy, okay? When that needle is going into the tissue, before that needle pierces the skin, everything that we talked about in this presentation should be going through your mind. What are you trying to do? Why are you trying to do this? What is on the other end of that needle? If I stick this needle in and I hit a hard spot, what am I touching? Am I touching the femur? What is it? Is it scar tissue, right? We have to know without a shadow of a doubt what we're doing, okay? And so I would challenge you to, like, man, brush up on your anatomy. Like, my wife will tell you, Body Worlds, the body exhibit, like, I saw that stuff. I go as often as I can. You know what I mean? apps. There's lots of apps out there. There's actual seminars now where you can go and look at cadaver dissection. I would encourage you and challenge you to take advantage of these great opportunities. Because even if you're not going to use the needle, okay, you can still use it to improve your outcomes. The knee. I mean, how many of us in here have athletes just wear us out with their knee, right? Have you seen the anatomy of the knee? Like, it's crazy. Like that, it's just a bunch of connective tissue. How can it be so problematic? But if you start to look at that, right, and you start to see the various layers, and you start to see how the VL blends into that fascia, you start to see how the VMO blends into the fascia. If you start to see that the VMO is actually a really long muscle, it's not just the VMO, it's the VML, right? And if you start to consider those things, and that starts to drive you, right, and you're able to be a better clinician, okay? And that's my encouragement to you. I'm going to close with this slide right here. Okay, if you haven't seen it, Dreams of Sushi. Netflix, it's a great movie. It's all subtitles. But that man right there, he's like 80 years old. And he's like, hey, like, I still don't know what I'm doing with regard to sushi. He's one of the greatest sushi chefs in the world. And what he says in this slide is that once you decide on your occupation, you must immerse yourself in your work. You have to fall in love with your work. Never complain about your work. You must dedicate your life to mastering your skill. That's the secret of success, and that's the key to being honorable. And that's the challenge for us, ladies and gentlemen, is for us to go out there and for us to continue to be who we are and to remember that we can always get better, because at the end of the day, what this is really about is the people that we serve. Thank you very much for your time. Yes, ma'am.
Okay. With your high school experience, would you use this on high school athletes?
So I have a colleague. His name is Scott Galloway. He's the head athletic trainer at the DeSoto ISD, and they use dry needling in their athletic training room because they have their team doctor who's backing them, and he has allowed them to do that. So, can we do it? Yes. Right? Would I do it? Yeah. Like, I'm perfectly confident. I've had 11 years of apprenticeship, and I am now at the point where I'm assisting instructing, right? Now, like I said before, you don't have to stick the needle in yourself, right? But it's important for you to know what's going on so you can direct traffic. That's what we do as ATCs, right? We help to guide our athletes to the right people to get what we need done, right? Because guess what, guys, and we all know this, if we aren't offering the service, what are the kids going to do, right? And wouldn't you want to be the one who's directing traffic instead of having them coming back to you, well, so-and-so said, man, seriously, when they go to Mexico and come back, I was so angry. But it was my fault, right? Because I wasn't meeting their need. That's why they were going somewhere else. Don't go to Mexico.
All right. One more. Is dry needling allowed at the high school setting?
Well,
or how do you get it allowed?
So the way that I would approach this is I would obviously talk to my booster clubs, talk to my AD, get my team doctor, and then you would have a consent form, right? So if somebody is, you would draw up a consent form just like we did with the, with the Advil and just with concussions, right? And then the athlete can sign the consent form, and then if it's up to you whether you want to use this or not. Because you know what? Let's be honest. And like I said, I was a high school ATC, right? We have a little bit more leeway in the high school than we do in the collegiate setting with regard to trying to get people back right away. Like we can give them a little bit more time, right? But it's a very, 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 we still have the athlete who's got, whatever, the IT band or the plantar fascia or whatever that's just killing you, right? And so you as a clinician can utilize the needle to help deactivate whatever trigger points are in that spot and help the athlete to get out of pain. So then the question is, well, why wouldn't you want to use something that can benefit them that much and save you time, right? Because, guys, let's face it, we're all overworked. and we all got so many people that are pulling at us. So if you can cut a treatment from 20 minutes down to 10, why wouldn't you, right?
Of course you don't.
Yes, sir.
Sorry, microphones scare me. When you're talking about the consent form, is that required by law? Is that just something you suggest that we have on hand for documentation?
I would suggest that we have it on hand for documentation since we're dealing with the minors, right? We want their parents to say, hey, it's just like the Advil, right? Like, I don't think that's required by law, but it's us taking care of business, making sure that the parents give us their permission to take care of their child.
Anything else?
Thank you for the questions. I appreciate them.
How long did you do your apprenticeship, or did you before you felt comfortable enough to do it on your own?
So I started in 06, and I started doing it on my own in 2013, right? Because that's, for me and for how I felt, that's when I felt like I was ready to start doing it, right? Because at the end of the day, like I said, now you guys are smarter than me, right? I'm not very sharp, so I really need a lot of work on my anatomy, right? So if you feel like, man, I know my anatomy good, I know when I stick this needle in, I know what it's touching. And like we talked about, man, you don't have to needle this trigger point up here, right? Why? Because the lung field is under it, and it's not worth the risk. We don't have to needle the scalene, right? You can figure other things out, strain, counter strain, whatever, right? So we are athletic trainers. We have a tremendous little toolkit that we can pull from to get stuff done. I'm just saying that the needle can help you improve your outcomes in a shorter amount of time, right? And obviously, when you go to these seminars to learn, they'll teach you the danger spots. They'll teach you the safe techniques for how to needle, for how to get things done that you want to get done, right? And so that's the thing. Like, if after you go to the seminar and you're like, man, I feel really comfortable, you could take the seminar because you want to know what's going on, right? But you can also take the seminar because you intend to do it. If you take a seminar and you're like, man, I feel really good about this, I think I can do it, well, then go for it. Me personally, like I said, I've been an apprentice since 06. I have 150 hours of education, actual going to seminars and stuff like that. So, it really is up to you and how comfortable you feel with what's going on.
Have you gotten other athletes other than track and cross country to come to you for needling, or is the staff all qualified?
The reason why I acknowledge Mr. Hedrick and Dr. Bramhall is because through their vision and leadership, our entire staff is now able to dry needle, right? And so we have all taken a seminar together. We're going to take another seminar here in a month at A&M. So we all know what we're doing. We're all on the same page. We help each other out. You know what I mean? Sometimes I'll go to the swimming trainer and say, hey, I'm jacked up. Can you help me? She'll come to me. Hey, can you help me? And we work with each other and we collaborate.
Anything else?
So once again, it is an honor and a privilege to be able to speak with you. I will be doing the same talk at ATA at 7:30 a.m., right? So I'm expecting a smaller turnout, so I really appreciate you guys for being here. Thank you so much.
Thank you. On the app, the updated surveys are listed. If you could please do us the favor and fill out those surveys. If you attended the earlier sessions, please feel free to fill out those as well. They are updated. Also, if anyone is staying at the Holiday Inn Express, there was lost room keys. Please check, and we'll have them up there. They were left at the Cornish medical table. So if you are missing your room key, please see us.
Can you hear me? The surveys aren't on the survey portion of the app. If you go to the schedule and you look at each session separately, then it'll take you to the complete survey portion. So it's not on the actual tab that says surveys. It's on the individual schedule.
Check.
Dr. Dorinda Rodriguez recently earned a doctorate in occupational therapy from Rocky Mountain University of Health Professionals in Provo, Utah. Dr. Rodriguez